Hello everyone, I'm Urologist Ömür Erdem Akkaya. Today I am going to talk about not being able to get off the masturbation axis. One of the first things men with erectile dysfunction usually do is test their penis through masturbation. The penis is a very emotional organ. When masturbation is attempted in this way without background, two situations arise. One is that it gets really hard, but that does not mean that one will be successful in normal sexual intercourse. The second is the failure of masturbation, and there are those who cannot feel the old pleasure. There are those who say that their penis has lost its hardness as soon as they stop. With repeated unsuccessful masturbation attempts, the person begins to feel anxiety, stress and panic. And this intensifies with repeated failure. This causes further problems. Friends, I first keep patients who come with this problem away from masturbation and sexual intercourse for a while, because one of the brain's best defense mechanisms is forgetting. After the panic and stress have subsided a bit with expert assistance, things can be fixed. How often should you masturbate? It is not right to masturbate every time you feel like it. We have done a video before about traumatic masturbation syndrome, and there are many videos about it on the internet. If this is done too often or incorrectly, it can lead to symptoms such as premature ejaculation, delayed ejaculation, deflation of the penis when entering the vagina. So when should you not masturbate? This is one of the most important questions. Masturbation should be avoided if you are married, if you have an active sex life, or if you are looking for a sexual partner. Some patients present with erectile dysfunction. They have intercourse 1 to 2 times a month, but they masturbate 8 to 10 times a month. This is like a football player who goes to a disco or bar even though he has a game to play the next day. As a result, he dampens his diminished sex drive by masturbating and cannot transfer his energy to his partner. Of course, this is true in a happy couple relationship where the desire is there. If there is a problem in the couple's relationship, what I have described makes no sense. Another important issue is pornography and masturbation. When you look at pornography, you have to imagine that you are watching Spider-Man or Marvel. Neither the women nor the men are realistic. I mean, the bodies of the women there are perfect, their behavior during intercourse is professional, and there is a fantasy at play. But if you get married one day, you might have an image like this while you are trying to have sexual intercourse. Your wife may have her legs pulled together, her vagina contracted and may be looking at you anxiously like she has vaginismus. This is, of course, just one example. The frequency is low. But after seeing the women in porn, if you meet a partner with vaginismus, you have no chance to maintain the erection. Or this woman's ability to transmit female energy goes from very bad to very good. You do not know what kind of energy you are going to get. So there are many reasons why you should not watch porn. Apart from that, there is also the problem of pastes. So-called pastes are erectile enhancement products sold in herbal stores. Sold as natural, but containing sildenafil citrate, the active ingredient in Viagra. They are mixed in liquid drinks called Plus 18, in Turkish Delight, in chocolates, in everything. Some people ask, if it is the active ingredient in Viagra, why is it so cheap? In fact, the drugs considered equivalent to Viagra by the Ministry of Health cost almost as much as chewing gum. I tell patients to divide it by 4 and take 25 milligrams, which is 16 pieces. In other words, affordable medication that can be easily taken and used under a doctor's supervision. Now the patient says, the herbalist told me to take a teaspoon, I took 2 tablespoons and it still did not work. The vast majority of patients who contact me with erectile dysfunction have used paste. Some say, I have been using the paste for 10 years, but it does not work anymore, I have erectile dysfunction. In fact, erectile dysfunction started 10 years ago. He has been treating himself with sildenafil citrate for 10 years, he comes to me expecting treatment from me. But the problem is if the person is using paste, but they do not know what they are actually using, how much dose they are using. As I said, They do not know whether to use a teaspoon or a tablespoon, they do not know what the content of the product is. There is no standardization, no control, maybe it is 100% pure, maybe it is 25% pure. Even the herbalist does not know, and we cannot blame him. The herbalist also buys it, mixes it and sells it. Here you do not know how pure the product is. Maybe every time you use a paste, you take 2 to 3 tablets of Viagra. The patient comes to us after taking high doses of Viagra for a long time. In fact, erectile dysfunction is a chronic disease, that is, a long-lasting disease. When erectile problems occur with a person, the problem that is causing them must be addressed first. Sildenafil citrate, which we call Cialis or Viagra, is never curative, it is a maintenance therapy. In other words, it covers the problem well, but the problem slowly grows underneath. At a certain point, the person can no longer be satisfied with the dose he took initially. People say that Viagra is addictive, but in reality, Viagra is not addictive. The problem grows under it. And after a certain time, it may not benefit even at higher doses. So if there is a situation that can be treated and eliminated in a simple way, it should be eliminated. Finally, an erection is both physical and mental, and it arises in a strong couple relationship where there is desire and lust. In general, I've tried to address 4 to 5 topics in this video. I don't like to talk about masturbation, but I see these issues frequently with online patients and patients who come to the clinic. So I wanted to share them with you for informational purposes. Thanks for listening, best regards.